All right, so this is one of the most concerning things I've read in the past couple of weeks, and I've read and covered a lot of concerning things. RFK Jr.'s autism study collecting Americans' private medical records. And as we're about to read here, he essentially wants to create an autism registry to track autism diagnoses, like down to like if you get a autism diagnosis, you're put on a federal registry. Isn't that a little bit concerning? Especially when you have like already, and I'm going to say it, don't get mad, MAGA. I don't want to hear it, but when you already have all these fascist, authoritarian, Nazi, dare I say, links and things you can point to in this administration, and now we're going to have a registry with autistic people on it. And they are already, they haven't came out and directly said this, but they're already creating registries for other people. An example is, you can see this in the Harvard lawsuit. They want Harvard, the Department of Homeland Security wanted Harvard to hand over all student records and violations for foreign students. Isn't that a little concerning? And sorry if you can hear background noise. Every time I hit record, Luna just has to go crazy with a toy. Yeah, bitch. Anyways, so let's read. And there is, I'm going to, since this story is just so fucking weird and dark, I'm going to end the video with a better story that relates to RFK. One of the good things that he's planning on doing so far. So, the National Institutes of Health, NIH, is collecting the private medical records of many Americans from several different federal and commercial databases to give researchers for U.S. Health Secretary RFK Jr.'s new autism study. With this information being included in the database, the NIH is also reportedly crafting a new registry to track those with autism, per CBS News. The health agency claims it was doing so to fulfill a controversial promise the Secretary of Health made to root out the cause of autism by September, despite some experts like 99% of experts saying that Kennedy's goal is not even feasible. If you just ask me as a scientist, is it possible to get the answer that quickly? I don't see any possible way, Dr. Peter Marks said on CBS's Face the Nation earlier this month. And we already know why there is more autism diagnoses and why it's increasing. It's because over the years we have, well, for one, we've expanded the definition of autism. It's a spectrum. They've moved other mental disorders to the autism spectrum, such as Asperger's. And along with that, we've gotten, it's more common for people to come out and seek medical help for mental issues, whether that be something that could be considered on the autism spectrum or, anxiety, depression, all of that, and just in general. And we've gotten better tools and we've gotten better understanding of autism. So when you combine all that together, yeah, obviously we have more diagnoses now, especially when you've opened up a spectrum. And you've seen his remarks. I didn't directly cover it, I don't think, like a week ago, where he was like, yeah, autistic people would never use the bathroom unassisted and never pay taxes and never live without aid. All that, like, it's like, what are you talking about? Oh, geez. So that's crazy. That's crazy. On the collection of data, the director of NIH, Jay Bhattacharya, I don't know what the fuck name is that, bro, told advisors during a presentation on Monday that the aim was to help researchers study autism by giving them access to comprehensive patient data and health records. He added that these records would cover a broad range of people across the U.S. The idea of the platform is from the existing data. Resources are often fragmented and difficult to attain. The NIH itself will often pay multiple times for the same data resource. He said in a presentation, even data resources that are within the federal government are difficult to obtain. Well, yeah, no shit. We have like this whole thing called like HIPAA and, a general sense of extreme security for your medical records and data. So it's kind of a good thing that the federal government can't just willy-nilly say, hey, I want this whole person's medical history. It's not intended to be like that for a reason. weird last name, added that the NIH was also discussing a potential expansion of the agency's access to data from the Center for Medicare and Medicaid Services. The study also plans to link medication records from pharmacies, lab testing, and genomics data from patients treated by the Department of Veterans Affairs and the Indian Health Service, claims from private insurers, and data from smartwatches and fitness trackers. Brother, holy hell. Like, if this would have happened under the Biden administration or this guy has definitely happened under the Obama administration, they would have stormed the Capitol building again. Like, this is crazy, and they're just coming out and saying it. Oh my goodness, that is crazy. What we're proposing is a transformative real-world data initiative which aims to provide a robust and secure computational data platform for chronic disease and autism research. Echoed Kennedy's words that some answers as to the cause of autism would be discovered by September, but he added that the study would be an evolving process. The news followed Kennedy's first press conference in which he claimed that a significant and recent rise in autism diagnoses was evidence of an epidemic caused by an environmental toxin, despite the evidence collected by health researchers, and that evidence being what we talked about with just expanding the criteria and spectrum of autism and just a better understanding, more people coming out and seeking that kind of help. Like, it's getting hard for me to do these videos because, like, after I read these, I just want to stare at the wall, like, blankly for 10 minutes and process, like, what the fuck I just read. Because, like, this is crazy. Okay? Anyways, a good thing that Kennedy is doing and something that he ran on and something that I completely agreed with. And that is banning artificial dyes from food and drinks because, and this is one thing that I will always agree with Kennedy on, and that is, he said something along the lines of, I'm not going to do the voice, it hurts. You look at a box of cereal from the United States and you compare that with a box of cereal from, say, Canada. There's like a quarter of the agreements in the Canadian version versus the American version. And the quality is the same, if not better, in Canada. So I completely agree with this. I wish he would stick to focusing on stuff like this instead of anti-vax nonsense and claiming that autism is an epidemic, because in the grand scheme of things, he wants to try to circle this back to vaccines, as he's said, even though he says he's not anti-vax anymore, but whatever. U.S. will ban 8 commonly used artificial food dyes in a bid to help Americans know what's in their food, Health Secretary Robert F. Kennedy Jr. announced on Tuesday. Officials said 2 petroleum-based synthetic dyes would be phased out in the coming weeks and others by the end of 2026. Experts have linked the dyes, which are found in dozens of food, including cereals, candy, snacks, and beverages, to neurological problems in some children. The Food and Drug Administration plans to authorize 4 new natural color additives in the coming weeks to help companies find alternatives quickly, the agency said. See, this is shit. Like, not only is this a phase-out plan and not taking an axe to something and going through it all willy-nilly, like, not only are they doing a good thing, but they have a plan. They have a phase-out plan. And not only do they have a phase-out plan, they have methods and ways to help these these companies that produce this food to switch to healthier alternatives. See, why can't we do this across the board and just drop all the crazy shit? You know what I'm saying? Like, sometimes I read this and it's like, oh wow, it can make sense sometimes. But like, I'm giving credit here, but don't make me think I'm an RFK Jr. guy. This guy's a monster. This guy's a literal lizard person. But I will give credit where credit is due. And it is very dude here. On the campaign trail alongside Donald Trump, Kennedy last year vowed to take on artificial food dyes as well as ultra-processed foods, once confirmed to lead the top U.S. health agency. On Tuesday, the health secretary pledged to tackle other food additives, including every ingredient additive to food in school that we can legally address. Most artificially colored foods are made with synthetic petroleum-based chemicals, according to Nutrition Nonprofit Center for Science and Public Interest. Synthetic food dyes are found in dozens of popular foods, including M&M's, Gatorade, Kool-Aid, and Skittles. For the last 50 years, American children have been increasingly living in toxic soup of synthetic chemicals, FDA Commissioner Marty Makary said. Makary said removing the food dyes was not a silver bullet, but one important step to improving children's health. The FDA plans to revoke authorization for food dyes, red number 2, and Orange B within the coming months, according to the Department of Health and Human Services. 6 remaining synthetic dyes: FDNC green, number 3, FDNC red, number 40, FDNC yellow, number 5, FDNC yellow, number 6, FDNC blue, number 1, and FDNC blue, number 2. It shit doesn't even sound good. So, again, credit will be removed from the food supply by the end of next year. The only purpose of artificial food dyes is to make food companies money, said Dr. Peter Ullory, a former FDA official said to represent the CSPI. Food dyes help make ultra-food processed foods more attractive, especially to children, often by masking the absence of a colorful ingredient like fruit. He said, we don't need synthetic dyes in the food supply, and no one will be harmed by their absence. Absolutely agree. Like, yeah, it's obviously, you make it colorful, you make it look good, and people are going to buy it. No, nothing controversial there. Companies have found a way to eliminate many of the dyes in other countries, including Britain and New Zealand, said former New York University nutrition professor Marian Nestle. For example, in Canada, Kellogg uses natural food dyes like carrot and watermelon juices to color Fruit Loop cereal despite using artificial dyes in the U.S. How harmful the synthetic dyes are is debatable, said Miss Nestle. Nestle? Like, is that like a Nestle? Probably. They clearly have behavior problems for some, but by no means children, and are associated with cancer and other diseases in animal studies. She said enough questions have been raised about their safety to justify getting rid of them, especially because it's no big deal to do so. She added, plenty of non-petroleum alternative dyes exist and are in use. And, you know, you might say, why don't they just, why do these companies, if they make this like with natural colors and flavors in other countries, why don't they do that in the US? And it's probably just money. It's probably cheaper to use these synthetic dyes. That's my assumption. I don't think they're intentionally poisoning people. That's not very good as a food company. Not good for your bottom line. So it's probably just cheaper. Let's see. Enough questions have been raised about their safety just by... Oh, wait. Nope. Already read that. In 2008, British Health Ministries agreed to phase out 6 artificial food colorings by 2009. While the European Union bans some colorings and requires warning labels on others, in recent months, Kennedy's food dye ban has found momentum in several state legislators. West Virginia banned synthetic dyes and preservatives in food last month, while similar bills have been introduced in other states. So yeah, I don't know what you want me to say. This is good, and probably like the second or third thing out of everything that's happened from this administration that I agree with. And I'm not afraid to admit that, because this is a good thing. And I wish they would stick to this kind of good stuff. But anyways, let me know what you think in the comment section down below, and I will see you in the next one. If you made it to this point in the video, I just want to give a special thank you. If you enjoyed it, please hit that like button down below. And if you really enjoyed it, maybe consider hitting that subscribe button while you're down there. I want to hear your thoughts in the comment section. I will try to reply to any and all comments that I can. Until next time, watch that video on screen.